Hello, I'm Simon Stevens, the Chief Executive of NHS England. And this film will tell you about NHS England and how you might want to get involved in our work. First, I'd like to introduce you to Katie, Aaron, and David. They're the voices that you're going to hear in this film.
We hope you enjoy watching this film. It has a lot of information and you may need to watch it a few times to take it all in.
So let's get started. What does NHS England do?
NHS England is involved with health.
NHS England aims to improve health, well-being and healthcare for people in England.
NHS England wants everyone to have more control of their health and live longer, healthier lives.
There are lots of ways NHS England does this. It looks at what needs to improve and gives guidance to other parts of the NHS on how to work in the future.
It acts as a leader for other organisations that work in health. Organisations like clinical commissioning groups, CCGs for short, who make most decisions on local healthcare.
NHS England works with other groups who are involved with health. For example, it works with the Department of Health, the Care Quality Commission, who inspect services, and Skills for Health, who make sure that healthcare staff have the right skills and attitudes.
NHS England also looks at problems in healthcare and tries to make them better.
For example, it works to find cancer earlier so that people don't get very ill.
It is helping to stop people getting diabetes and to improve the treatment. And is working on improving mental health services.
So, how is all this paid for?
Money.
The government gives money to the Department of Health to be spent on health and social care. NHS England receives some of this money. It decides how to spend this money on health services and helps to make sure it is spent well. Most money goes to clinical commissioning groups to pay for your local health services like hospitals and community services. Some of the money pays for primary care services, for example your GP and dentist.
Involving people.
NHS England works with people who use services and their carers, people like you and me.
Because everyone is different, it's important that all types of people get involved so all groups are represented. They can tell NHS England what they need and want from services.
Let's take a look at one piece of work where involving people is making a big difference to care. Annual health checks for people with a learning disability. This is just one example of the work NHS England is part of. People with a learning disability often have worse health than other people. NHS England wants to make sure as many people as possible with a learning disability have a really good annual health check. Health checks help doctors find out more about people's health.
NHS England has been talking to people about what they think would improve annual health checks. NHS England is putting all these ideas together so that doctors all over England can use them when they do annual health checks.
NHS England is also working with partners to develop different ways to check the quality of annual health checks.
This means NHS England will keep hearing your feedback and continue to improve how the system works.
NHS England is proud of its work in partnership with people who use services and their families and carers, and wants to keep listening to people. If you want to find out more about how to get involved in the work of NHS England, visit the Involvement Hub at www.england.nhs.uk/participation.
If you want to be involved in NHS England's work for people with a learning disability, email ldengage@nhs.net to join our network.
Thanks for watching.